Support comes from BECU, a member-owned credit union putting people over profit, offering financial services and support to the community with access to local financial centers, over 30,000 ATMs, and online resources at becu.org. Federally insured by NCUA.
Support comes from Soaring Heart Natural Beds, where concern for the health and safety of sleep now extends to everything from curbside pickup and delivery to secure in-store appointments. Showrooms in Seattle, Bellevue, and now in Edmonds, or online at soaringheart.com.
Hey, good morning. It's Patricia Murphy. It's Tuesday. This is Seattle Now. Vaccinations are making it safer to get out, but there's still a lot of COVID out there. And even a mild case can be pretty brutal. In a minute, fully vaccinated NPR science reporter Will Stone will tell us a few things on his mind since his bout with breakthrough COVID last month. But first, let's get you caught up. A little more than a month away from Governor Inslee's deadline, a group of state employees are challenging his vaccine mandate in court. More than 90 state troopers, firefighters, and ferry workers signed on to a lawsuit filed in Walla Walla County Friday, seeking to overturn it. They say Inslee's requirement that state workers be fully vaccinated by October 18th to keep their jobs is unconstitutional. A spokesperson for Inslee's office says the move is legal and essential for saving lives. There's new rules for delivery apps like DoorDash and Postmates doing business in Seattle. Starting tomorrow, third-party apps will need permission before posting a menu and taking orders for food. The law is meant to protect a restaurant's reputation from disappointed customers who get bad information. One restaurant owner tells the Seattle Times he was getting orders for food off a menu he wrote 8 years ago and didn't have the ingredients to make. Apps that don't follow through within 3 days can be fined $250. And big honors for one local brewery at last week's Great American Beer Festival. Belltown's Cloudburst Brewing was named one of the country's best breweries of the year. Lots of love for Seattle beers. 10 breweries around the city took home awards, 18 nods in all for the state. You can check out the list of winners for yourself at greatamericanbeerfestival.com. If you're like me, you've been playing this pandemic by the book, keeping your distance, masking up, fully vaccinated. And like me, after 18 months, there are probably times you've been feeling pretty done with it. Even the news about Delta and rising hospitalizations, there are moments when my personal risk meter has sputtered along the way here. Seattle-based NPR reporter and editor Will Stone knows what I'm talking about. Maybe you saw his most recent story about his breakthrough case of COVID and what he wished he had known. Will, thanks so much for taking the time.
Happy to be here.
So you got sick in early August. How are you feeling now?
I'm feeling basically back to my baseline health, but it took a while. It didn't happen right away. I spent a few weeks really low, fatigue, not quite myself. So
you got walloped.
I did, and I did not expect it because I was vaccinated, and I've been covering this for quite a while now, living it just like everyone in Seattle has been since that first case. And I didn't quite appreciate what a mild breakthrough case meant. It was rough.
Yeah. Tell me what happened.
Basically, I flew home to the East Coast, where I'm originally from, for my first trip back to see family and also to go to a wedding, which a lot of people know, these were delayed, and I wanted to see my friend get married. So I went on multiple flights. I hung out around the city. I stayed at a hotel, and a couple days later, I started to feel tired, very, very tired. And I just thought, traveling, I'm exhausted. So I thought it was maybe allergies or just a little cold, but it kept coming, the symptoms. I started to lose my sense of smell, which we all know is a big red flag. And then I started getting a fever. And by then I was pretty suspicious that maybe something was going on. I tried to get tested. I got a rapid test. It came back negative. So I was slightly reassured, but then I kept getting more sick. Second test a day later also came back negative. These are the rapid antigen tests that everyone is getting because they're fast and they're convenient. And if you look around, they're sold out in a lot of places these days. they're not as good as the ones that are sent to the lab. And those are the PCR tests. At least most of them are sent to a lab. And those are the reliable gold standard. And that took a couple days to get back, and that showed I did have an infection. But I did include that detail because I think it's important for people to know that even though these rapid tests are very useful and convenient, you can't hang your hat on it. And that is exactly what the nurse told me after I looked at her kind of bewildered that it wasn't positive the second time. She said, "Don't trust this. We're seeing a lot of these cases where people actually are infected and it's negative on these tests."
It sounds terrible. It sounds really terrible.
Oh, yeah. I was lying in bed, total exhaustion. I would go down to get a cup of tea from the kitchen with my mask on, and I would come back up and I would literally throw myself into bed for 2 hours. I couldn't think well, and my fever got up to almost 103, and it hung out there between 101 and 102, 103 for a couple days. I was laid up, and it was also, even when I got over the initial fever, I mean, that fatigue just stuck around with me for 2 weeks. I wasn't exercising. I would wake up and I would still be tired, 2 hours later. This is what people talk about when they have COVID, even before they were vaccinated. And it was my experience. It was a trip.
There's the physical part of being sick, which we're talking about, but then there's the mental part. I'm curious what was going on in your head during these periods of time where you're exhausted and you're a science reporter. You can see all the possibilities, Will.
Yeah, sometimes it's not good to be too steeped into the COVID research. It's like these medical students that go to medical school and they think they have every disease. I imagined every bad outcome from COVID, even though I knew that the vaccine clearly has set me up to have a very slim chance of being hospitalized. This is true even with the Delta variant now. But in my head, I was thinking, my gosh, what if I start having trouble breathing? What if I spread it to my father and to my family? I might have spread it to them before I started masking and being more careful. And I also worried about long COVID, which is, you don't know until later if that's going to happen and how long it will stay.
What can you tell us about the rate of breakthrough infections in Seattle?
So breakthrough infections are happening, and I was checking out the data, and there are thousands of them that happened in the last month or so. And that can be a little startling, even when you see that, okay, a lot of other infections have happened in non-vaccinated people. So you just have to keep in mind that the numbers don't tell the full story, that there are a lot more people who are vaccinated right now. And so you're going to have more breakthrough in that population. Doesn't mean your risk is super high. It's still much higher if you're unvaccinated. But it is happening more, and we are still in the middle of a surge, and the hospitals are being crushed all around the Pacific Northwest. It's not a good time to get sick, even if you are not going to get as sick as you might have gotten if you weren't vaccinated. And so people have to be relatively careful in the ways that they have been. And generally people are in Seattle, I think, but it's been a hard adjustment to that.
King County is very vaccinated. So is Seattle. How should people who are vaccinated be thinking about their protection from this virus, given that we are hearing about so many breakthrough cases right now?
That's right. Well, we know you're still very protected against the worst outcomes like hospitalization and death. We also know that we are finding high viral loads, lots of virus in the nose of people who are both vaccinated and unvaccinated. And that suggests pretty clearly that vaccinated people can transmit the virus. Now, there's a lot about this that scientists are still trying to wrap their head around. But, what is the typical person going to do with this information about viral load in their nose? I would say treat yourself as an infectious person that needs to stay away from others. If you are at all symptomatic or have tested positive for COVID and you're vaccinated. And I would also say you should probably get tested if you feel like you were in a situation where you were exposed or you were at a high risk. It's kind of a lockdown light. And basically that means try to be around other vaccinated people as much as you can. Wear masks, go to places where people are wearing masks, avoid indoor dining. I mean, it's similar to what we've been hearing for a year and a half. But I think it's harder because you do have the comfort of knowing you probably won't get so sick that you're going to be hospitalized. So it's kind of up to you what level of risk you're willing to accept if you're vaccinated and not high risk already.
And you make the point in your piece that maybe it's time for a little bit of a reality check around vaccines. They are not an impenetrable field.
That's right. And clearly the experts have been telling us this. These vaccines were made to stop you from dying or from getting severely ill. They're still doing a great job at that. But a lot's happening that even the scientists, as I was reporting this, they're still trying to figure it out because some of this is perhaps the vaccines, there's waning immunity, they're not as protective for certain people. Some of this is people stop taking precautions. And some of this is we have this new Delta variant that is much more contagious. And we don't really know how those things are interacting and what is more responsible than the other yet. But we do know they're all coming together to create a situation where there are more breakthrough infections, both here in Seattle and around the country. So you have to keep that in mind when you consider things that maybe a couple months ago you would have been happy to do, like eating in a crowded restaurant.
It's all about risk assessment right now. How are you thinking about this? You've already had COVID. Are you locking it down? Are you worried about getting COVID again?
So this is a tricky question because I have been told now by a number of experts that I have some kind of amazing super immunity. But and I love that idea. That's a great idea. And yet, honestly, my risk calculations have changed because I don't want to take any chances right now. And I think it's at least wise to try to pull back some of your more risky behaviors until we get past where we are right now, which is we're coming down, hopefully, from this surge. And there's a lot of virus right now. And hopefully there won't be as much virus in a month. And your chances of coming in contact with people who are infected will go down. That's what, at least, those are what the projections show. And so I am being more careful all the same. I wear my mask around. And it was a pretty eye-opening experience that I don't want to even risk repeating.
Hindsight, of course, Will, is 2020. Would you still go to the wedding?
Wow, that's quite a question. I would probably still go to the wedding, and I would have just made that decision to go to the wedding and not expose myself to a bunch of other high-risk activities along the way. And that's just because the wedding was important to me. It was a very close friend. But I wouldn't have stayed at a big hotel and gone out eating at that steakhouse where everyone was unmasked and all the other things that, really increase your risk.
Man, how many times did you roll every scenario over in your head while you're laying there in your fever dream?
Oh, you don't even want to know.
NPR reporter and editor Will Stone, very good to hear you've recovered. Thanks so much for telling us about your experience. Appreciate it.
Of course, it was my pleasure.
Thanks for listening. Jason Pagano produced today's show. Our production team is Caroline Chamberlain Gomez, Clare McGrane, Diana Opong, and Jenny Cecil Moore. Matt Jorgensen does our theme music. I'm Patricia Murphy. See you tomorrow.